The rising inequality and growing political instability that we see today are the direct result of decades of bad economic theory.
It's time to build our economy from the bottom up and from the middle out, not the top down.
Middle out economics is the answer.
Because Wall Street didn't build this country. Great middle class built this country.
The more the middle class thrives, the better the economy is for everyone, even rich people like me.
This is Pitchfork Economics with Nick Hanauer, a podcast about how to build the economy from the middle out. Welcome to the show.
The name of this podcast, Nick, Pitchfork Economics, most of our listeners know it comes from a piece you wrote 10 years ago in Politico titled "The Pitchforks Are Coming for Us Plutocrats." It was a warning to your fellow plutocrats that if income inequality kept increasing, bad things were going to happen. And bad thing did happen recently, which has brought attention back to this piece and the TED Talk you did that followed it up, the shooting of a United Healthcare CEO in New York.
I think what was most interesting about that assassination was not so much the fact that it happened.
Right, because shootings happen all the time. Yeah. I mean, we have school shootings.
Yeah, I think there have been 83 school shootings so far, mass school shootings this year so far, and there haven't been 83 CEO assassinations.
Right, and those school shootings don't really even get the media play that they used to. This is this is tragic. Look, our office, Civic Ventures, we are dedicated to addressing income inequality and gun violence. Right. Gun violence has always been a really big part of our portfolio.
Right.
We are opposed to gun violence. We see this as part of the gun violence epidemic, whether it's a school shooting or a CEO shooting. We are opposed. It is a bad thing.
It is.
But what's fascinating about this is not the shooting itself, which is unfortunately and tragically unremarkable in the United States of America in 2024. What was fascinating and disturbing and telling was the public response.
Yeah, people apparently enjoy CEO assassinations a lot more than school shootings, based on the public reaction to it.
Right. There appeared to be a lot more empathy for the shooter than for the victim and his family, which, I don't know, I guess I found surprising. Not surprising.
It wasn't exactly surprising, but it was kind of remarkable how visceral the reaction to it was.
Right.
And how, so many people were like, yay.
Yeah, and the iconization of the shooter.
Right.
The how many people were rooting for him to get away with it and were disappointed that he was turned in.
Yeah.
And it certainly took a lot of serious people by surprise. It took the media by surprise. It took politicians and pundits by surprise. And it exposes an incredible amount of anger at the health insurance industry and an incredible amount of, self-awareness amongst people that they have been victimized by this health insurance industry in a way that people feel like it has committed violence to them and to their families.
Yeah, I mean, and when you hear the stories of people's experiences, it's not hard to understand how somebody would become, how should you put it, homicidally angry, right?
I mean, clearly this guy had mental health issues and as well as health issues, but...
Yeah. But, if you have a loved one who's suffering and your insurance company is dicking around with you over a paperwork problem or whatever it is, it definitely would make you want to kill somebody.
Or at the very least not feel so bad about it. Yeah, it's because we don't want to make light of this in any way. And so, within a day of this, Nick, people were, like my daughter sent me something. Young people had discovered this. Like there were TikToks cutting up your TED speech. And this is And this is the thing, when you wrote that piece, when you did that TED Talk, it wasn't a threat, it was a warning.
Yes.
That this was unsustainable.
Yeah. And the other thing about this particular event is, and the healthcare industry, is that the context is because the healthcare industry is not the most exploitive industry in the country. The problem is that, it's the banking industry, financial services, and everywhere you go, at every turn you make, big companies are taking advantage of consumers in really unfortunate, distasteful, unfair ways, which just amps up everybody's anger about everything all the time.
But when you get exploited by the financial industry, it's not necessarily a life and death situation the way it is with the healthcare industry. And so to talk with us today about how exploitive the healthcare industry is and why people are so justifiably angry about it, we have returning to the pod Dr. Abdul El-Sayed. He is a physician, an epidemiologist, a public servant. He is the author of the books Healing Politics and Medicare for All, A Citizen's Guide, and a co-host of Crooked Media's podcast, America Dissected, that explores the intersection of health and society with leading experts in public health and policy.
My name is Dr. Abdul El-Sayed. I am a physician epidemiologist. I currently lead Wayne County's Department of Health, Human and Veteran Services, and I also host the podcast America Dissected alongside my co-host, Dr. Caitlin Jetelina, and I am the author of a book called Medicare for All, A Citizen's Guide, alongside Dr. Micah Johnson, and have been thinking quite a bit about American healthcare and all the ways it could be better, which I'm glad to be thinking about alongside all of you.
Abdul, what was your first reaction to the news of the United Healthcare CEO, Brian Thompson's assassination, and in particular, the surrounding discourse? What does this moment reveal about the growing tension between the public and the healthcare industry?
Yeah, first, deeply saddened for the Thompson family. I mean, this is a man, a father of two people, a husband who was shot in cold blood, and that's wrong. That's always wrong, and we should always call it wrong. You don't kill people, no matter the circumstances. That's not how we want to operate in a civilized society. And at the same time, I also, as you think about the reaction to the reaction, this has brought up a lot of frustrations for people. And it, I think, has misled us in terms of the directionality of our frustration. It's not about individuals, but it's about a system that we've allowed to continue to fester in this country, where patients in their worst moments, when they're sick or injured, are profiteered off of by many different sectors of one gigantic industry, which is the healthcare industry. Whether you're talking about pharma and the exorbitant prices we pay for our medications, you're talking about providers and the fact that healthcare costs continue to go up, whether you're talking about clinical visits or hospital stays, and of course, when you're talking about insurance, which is a sector that does not really add any real value, particularly considering the fact that it was designed to protect you from financial loss when you get sick, which actually is what it ends up exerting upon you when you get sick, in the forms of deductibles and copays that are putting people into debt in this country. And so it's two very sad things. I think people are connecting them, but we have to always remember that murder is wrong, and we do not condone that. And also, a system that profiteers off of sick people's bodies is also wrong. The one doesn't justify the other, but it does create a space where we have to talk about both wrongs and consider what we can do. We're never going to be able to bring Brian Thompson back, but we certainly can fix the healthcare industry and the healthcare system if we're willing to look it in the eye and ask what kind of collective society making can we bring to bear on this problem.
Yeah. If you would, for our listeners, just obviously most people sort of understand this intuitively, but I spent a bunch of time, not my career in the way that you have, but I did spend a bunch of time at one point on a business that was designed to reform the healthcare system. And so there was a time at which I knew the facts very, very well the differentials between what Americans pay, for example, for a colonoscopy and what everybody else in the developed world spends for a colonoscopy, what we pay for, ordinary drugs and what everybody else pays. There is a reason that the American citizen pays twice as much per year for healthcare as people from every other advanced society with worse outcomes. Can you detail some of the most egregious differences between our healthcare system and other healthcare systems that other advanced societies use?
Yeah, let me offer a couple of what's and then talk quickly about the why. So my office, I work in the city of Detroit, and Detroit's the only place in the country where you can go south to go to Canada. And so my office overlooks Windsor across the Detroit River. And when I look out my window, I'm looking at a place where they spend about 11% of their whole economy on healthcare, where we spend between 18 and 19% of every dollar spent on our whole economy on healthcare. And that, for them, that 11% buys them 2 years extra in life expectancy compared to us. And in survey after survey, they're happier for it. But then there's a part that the overall statistics tends to miss, which is in our system that is predicated on profit making for every piece of the healthcare sector. Our system discriminates against the poorest people. So there's not a situation in Canada where you don't have access to basic healthcare. Whereas in the United States, nearly 10 million people are uninsured. And then nearly 40% of our country is what's called underinsured, meaning you have insurance, but the price of your deductible or your copays are too much such that you don't actually get the healthcare that you need. In Canada, there's no such thing called medical debt. In America, our collective medical debt is bigger than the GDP of 50% of the states in this country. The collective debt we just owe for paying for healthcare. And to think about that, right? To just put an exclamation point on that number, nearly 2/3 of people who get a cancer diagnosis are going to declare bankruptcy as a function of that. I want you to think about what that means. Nearly 2/3 of people. So not only is this cancer eating your body, but it's also going to cost you your financial future. And that doesn't happen in Canada. If you want to give birth, right, chances are you're going to be paying thousands of dollars out of pocket to have a baby, which, by the way, we are having fewer and fewer of them. And in Canada, right, that's free. So that's just our system compared to the Canadian system. But the consequences for equity, the consequences for who gets healthcare and who doesn't, the consequences for the 10 to 12-year life expectancy gap in our country compared to far smaller gaps in other countries, those are things that sometimes go unsaid. And that is a function of the fact that we allow every piece of healthcare to be done for profit in this country. And so we end up paying way more, and we end up getting worse outcomes for it.
This is an economics podcast, and one of the things that was remarkable about the election we just had is how uninformed the American public seemed to be about the economy and their own economic interests and how these economic policies were impacting them. And yet the outrage that we've seen, and it's not outrage at the murder, but at the victim and the industry he represents, that tells me that the American public seems to understand this. I mean, are they as informed as they appear to be? And what is it about healthcare that leads people to be more in touch with their own self-interest?
Yeah. On the one hand, people are really quite informed about how broken our system is because too many people have had the experience of needing healthcare and then having to worry about whether or not they could afford it, or getting healthcare thinking that they were insured only to realize that the sure part of insurance didn't really exist for them and that they had to fight some nameless, faceless person on the other side of the line to get access to the care that they thought they already paid for. And the other side is, to blame this on one individual who is a cog in a far larger system is misguided. And I think what we saw was this outpouring of rage at the insurance system. And, as people tend to do, we tend to personify systems, which is probably unfair. It's definitely unfair to those individuals, but it betrays a sort of lack of understanding of how the system is architected and why the system tends to screw us. And, to your point, Goldy, it is a system. It's just a system that's not built for our healthcare. It is a profit-making system for a set of very, very large industries.
Yeah, it's built for the shareholders of insurance companies. That's what it is. And, and if I may, again, I've thought about this for a long time. I mean, the problem with private insurance is that it creates economic feedback loops designed to turn molehills into mountains. Because if your business model is taking 15 or 20% of every transaction, the bigger the transactions are, the bigger your business is, the more money you make, right? So the whole system is geared towards generating the largest expense. And the system makes the most money the sicker you are, right? So the whole thing isn't a healthcare system, really. It's a system designed to exploit people's sickness.
And U.S. healthcare is profiting from this at multiple parts of the system. They're not just an insurance company. I realized after the fact that the medical group that I've been going to for years, Polyclinic, I knew it had been acquired by somebody, but they recently rebranded as Optum, which then I realized, oh my gosh, that's U.S. healthcare. And I've joked in the past that they're like a reverse HMO because I have good insurance. They're constantly trying to get me to buy services, right? They'll send me to any specialist I want as long as it's within their group because they're making money off of that, billing the other insurance company. Perhaps if I had their own insurance, they would be a little stingier. I don't know.
You know, it's an interesting point, and there's a couple of pieces that you all highlighted there that I want to pick up and maybe offer a name to. Insurance companies, it's interesting. You pay so that they'll pay for your health care when you need it. But their incentive as a company is to do exactly the opposite. And that's counterposed to most business models. Like if you are a manufacturer of chips, you make money when you sell chips. But like insurance companies lose money when they provide you the thing that you actually entered into a relationship with them to do. To your point, Goldy, right? We tend to think of ourselves as consumers of healthcare, as customers. When you're a customer, you offer tender for a service that you get, right? But if you think about how the insurance system works, you are a reason that someone else offers tender for a service that you got. And so rather than being the customer in this scenario, you're actually kind of more the product. You're the reason money changed hands between folks. And Goldy, like for you, you are an account that is billable for Optum. So their goal is to bill for everything they possibly can bill for you. Whereas your insurance company is like, no. It has to be necessary care. But this sets up a really problematic situation because you all are economists, so I can use this kind of language here. In healthcare, we have what is ultimately the ultimate information asymmetry problem. We rely on doctors and hospitals to tell us what we need and then sell it to us, which means they have an incentive to sell us things that we may or may not need. It's like going to a mechanic, right? I'm a Detroit kid, so I like to pretend that I know things about cars. So if I were to take my car to a shop and you know the mechanic looks at me and says, oh, it's clearly a sprocket flywheel, I'd pretend to know what he was talking about, shake my head, and end up paying way too much money for a thing that doesn't even exist. Whereas when it comes to our healthcare, we just know that it hurts. We don't know why it hurts. And so we leave it to our providers to tell us why it's hurting and to solve it, which creates a whole bunch of problematic incentives. And in theory, insurance should be able to protect you from getting taken advantage of. But in the end, for them, it's just this delta between how much money you give us and how much money we get to keep. And because no one insurer is big enough, aside from Medicare, which of course we can get to is basically legally barred from doing this well, no one insurance is big enough to have the market power to actually negotiate with big healthcare providers. So they've just created ways to pass the costs back on to everyone else. So they create these cost sharing mechanisms like deductibles or copays, which are just ways to get you to pay for the thing you thought you already paid for. I always explain this when I teach as like, imagine you paid for Netflix every month and you go to watch that finale episode of your favorite show. And then all of a sudden you got to pay $19.99 to get it. You're like, wait, I thought I already paid every month. They're like, no. This one's $19.99 on top of it, right? We'd all feel some kind of way about it, but that's basically how insurance works these days.
And it's totally non-transparent, the pricing. I had my gallbladder out this year, and at one point I asked what something would cost, and they had no idea. They couldn't even tell me what it was going to cost.
And to be honest, Goldy, like the reality of is the cost really was a function of what insurance you had. Because it's a different deal for every insurance company. These are all what they call trade secrets.
It's not even really insurance. It's kind of like a prepaid discount card that if it's a covered If it's covered, then you get the negotiated price. If it's not covered, then you pay this inflated retail price, which is something I learned, Nick, before I went to work for you and had crappy insurance. and some things were covered and some things weren't. And I had no idea. And they never gave me a price list. It's just, so you'd see this bill at the end. Oh, it's $141 for this test. The negotiated price is $52. And that's what the insurance company paid. Then this other test, it's $164. Oh, this isn't covered, so you pay $164. You don't get the insurance company's price, you get the list price. How is anybody capable of being a savvy consumer in that type of so-called market?
Yeah, it makes it nearly impossible. And then the other problem with it is most of the time when we're getting healthcare, we can't even shop it, right? I think price transparency is really important. But like, if I started clutching my chest, I hope somebody around me will call 911. But I don't get to decide what hospital I go to. I'm not going to sit here and debate the doctor about what treatment I need. At some point, I'm just going to get what I get and hope I make it, right? And so even in this system, we don't have an approach to being able to actually ask or to think through, what is my cost outlay going to be? Like I had to have surgery this year. And I literally write books about this stuff. And I had to sit back and say, okay, given my deductible, I'm going to have to stash away a certain amount of money. Ended up maxing out all of my out-of-pocket costs to get this surgery. But then I thought about it. What if, there's an emergency situation where had I not gotten the surgery in time, I could have had to do it as an emergency. I wouldn't have been able to save the money up, and it really would have been an issue. And then I think about a lot of my employees who don't make as much as I make. Even if they needed to save up, it might take them years to be able to save up and then wind up in a situation where they have to have the same surgery under the gun. And so you don't really know what you're going to have to spend, even if you're like me. I'm 40 years old and in pretty good health, but you never really know what's coming around the pike.
Well, this is why we all need a medic alert bracelet that says, please take me to an in-system emergency room, right? Because I don't want to
with all your systems.
That's right. Yeah, I want one of the ones that what my insurance company covers.
Yeah, and the other really crazy, screwed up thing about the private insurance model as a way of giving you health care is that insurance literally only makes sense in the cases where something is rare, unpredictable, and catastrophic.
Right.
But 80 or 90% of healthcare transactions in your life are routine things, right? Whether, getting a wart burned off your pinky, having a cut stitched up, getting a colonoscopy, having your physical, whatever it is.
Getting older, Nick.
Yeah, whatever.
It's in that.
But
I mean,
whatever.
There's the alternative.
No. But all these things, most healthcare transactions are predictable and non-catastrophic. But because insurance mediates every single one of those transactions, the paperwork that is required to execute those transactions dwarfs the cost of doing the actual transactions.
Right. You're absolutely right.
Like, doctors employ teams of specialists who do nothing but insurance paperwork to just get reimbursed for doing the simplest of things. And this is why they're always pushing you towards specialists, because you can turn a cheap transaction into a profitable transaction by jacking it up. Like, again, why would you spend 25 cents to burn a wart off a pinky when you can send somebody to a specialist and turn it into a $1,000 transaction?
Nick, to your point, people don't think about hospitals as being these individual business units. But in every hospital, there are some units that subsidize others. And what happens with the units that end up getting subsidized is some business consultant somewhere realizes that these are cost centers that aren't making money, so they shut them down, which is why a lot of what you're seeing get shut down are primary care clinics, psychiatric clinics, right? Emergency rooms. And you think about, okay, so how is this in the public's interest? Well, it's not. It's just that, to your point, because the financial transaction cost itself of healthcare is so high, the value of this less procedural but critically important medicine doesn't actually adequately come out. And so they end up just excising these units because they're not making enough money. and you need to be doing major surgeries, right? Like knee replacements or hip replacements, that's where the money is. And you have to ask yourself, it's not just that this doesn't serve us well because we are paying through the nose or not getting healthcare at all. It doesn't serve us well because we're not actually putting money into the parts of medicine that add the most value.
Yeah.
None of us want to get sick. Like, you know, in our world, like if you need a knee replacement, you want to get a knee replacement, but you'd rather be in a situation where you never needed a knee replacement in the first place. But we're disincentivizing and disinvesting in that and waiting until you need that knee replacement, then giving it to you and then saying we did a good job. And in the end, we're all the sicker for it. And who's getting wealthier off of our backs? Well, it's the industry.
If we do feel bad about health insurance executives being assassinated, what would we do to avoid more assassinations in the future? How can we change the industry so that people are not quite so angry?
Yeah, instead of calling it Medicare for All, you can call it the Health CEO Protection Act. What would it look like?
Well, you know, we would never create a situation where there was such a lucrative opportunity for somebody to make money off of the back of denying people the health care that they thought they already paid for themselves and their family. And the way you do that is to do what we've already done for actually the majority of healthcare transactions in our country. This is the thing people don't appreciate. The majority of healthcare transactions, the majority of healthcare dollars are dollars spent via government healthcare because, well, people tend to get sicker and need more healthcare as they get older. We do this crazy thing where we insure people through the federal government after they turn 65, rather than extending that pool out to everybody, right? Both making Medicare more sustainable and also being able to secure access to healthcare that you don't lose when you turn 26 or you get married or you get a different job or you lose a job, right? We can do that by extending healthcare coverage. What that would mean is that the federal government can be all of our insurer. It can act as that negotiator to bring prices down and actually exert a level of force against providers. It can reduce the overhead costs of healthcare transactions because it's the only insurer in town rather than having to have armies of billers both on the payer side and the provider side. And it can make sure everybody in our country has access to affordable, accessible healthcare, right? That is the idea behind Medicare for All. And the irony of this moment, I just got to say it because I know I'm among friends here, is that you have one conversation that is about how progressives have missed the boat on talking about critical meat and potatoes economic issues. And the same folks who are having that conversation are pointing to this moment and saying, well, it'd be crazy if we passed Medicare for All. That's a loser of an idea. And if you talk to any family, I mean, here in Wayne County, we're working to forgive $700 million of medical debt. And that's just one county. You think that's not a meat and potatoes issue that folks working on the line in Warren or in Dearborn are not talking about? Like, that is the central one. And so we've got to get past the spin of the industry that tells us that we really, really love our private insurance and we couldn't do anything better. And if we want to win on an issue, this is the one. This is the one, because everybody's got a body and everyone wants that body to get the healthcare it needs if it gets sick.
Yeah, interesting. So you think that Medicare for All is the best path towards a reform?
Look, I think that there are ways to get there that will take time. And look, we're talking about 20% of the entire economy here, right? And anybody who thinks that there's like a switch in the White House that you can just flip and all of a sudden Medicare for All turns on, that's not how it's going to work. And so there's going to have to be a phased-in approach to thinking about how you start to extend this. That's a technical question. And look, we've done a lot of the thinking on how to do that, but it's going to take some time, but it has to be the direction we go to. But the challenge is this. I see people running away from the central set of issues. In healthcare economics and in healthcare policy, we almost seem unwilling to have conversations about the central issue of the fact that our prices keep going up, that we are the only high-income country in the world that has this fully privatized health insurance system between the ages of basically 0 and 64. And instead, we think about these like little edge cases about ways that we can save a couple of dollars here or there. And I just think we need to run at the problem and talk through the central issue at play here and face it up. And look, whatever name you want to call it. I'm not stuck on Medicare for all, right? But engaging with real government responsibility to provide access to health insurance in a way that the privatized system is failing to do, we've got to have that conversation in plain language and face up the fact that the industry is the reason why we are unwilling to have the conversation.
Yeah, I'm afraid that the Obama folks set us back, because the Obama approach to healthcare reform was take the world's worst healthcare system and make it bigger. That's what we did, effectively. You know, America's healthcare system, I think, is best understood as the world's largest price fixing scheme. And we just extended that model to more people.
We gave more people access to it.
Yeah, we gave more people access to that terrible system.
Which, to be fair, look, improved a lot of people's lives over what the previous system was.
It did. And we did some other minor things at the margins. We constrained the VIG that insurance companies could take. We made sure that pre-existing conditions was a big one. Other couple of things.
Because that was catastrophic for people.
That's right. But it was not healthcare reform.
Yeah,
it
was reform. It just wasn't enough reform.
No.
But you know, Abdul, the last time we talked to you was in September of 2020, about 6 weeks before the presidential election. And we approached that conversation with a lot of optimism for the next 4 years. And we're recording this in December of 2024, about 6 weeks after the presidential election, and, you know, a few weeks before Trump is re-enthroned. Can you approach? Is there any optimism?
Let me try. So just on the ACA, look, any effort to extend more and better healthcare to people is a good thing. But to your point, Nick, the challenge was that we tried to stabilize what is ultimately an industry-designed system. And so if we were only going to do what industry assented to doing, of course, they were going to make sure that they made a lot of money off of it, and they did. And it did not contain prices. So I'm not against the ACA. I think we can continue to improve it. That being said, structurally on its own terms, it was never going to solve the problem. I think there is hope in some respect because, look, I served on the Healthcare Unity Task Force that now President Joe Biden put together. But I also had an inkling that there wasn't going to be much movement on healthcare, in large part because nobody wanted to talk about health anymore, right? After the pandemic itself became the thing that you politically could not touch. Republicans pretended that it didn't happen, and Democrats pretended that it was over. And this, despite the fact that, you know, it persisted well longer than the period in which we were able to talk about it. And after that, there was, I think Joe Biden had scar tissue around his experience from the ACA and didn't feel like he wanted to squander any of his political capital on healthcare reform. And so in some respects, I think right now, as Democrats are searching for where we go from here, I actually think that there's an opportunity, ironically, to come back to the biggest single festering issue that continues to bedevil the American public, which is healthcare. If, you know, we're looking for an issue that unites people, clearly this is one that unites people, right? And they are outraged about it. And the truth of the matter is, and we gotta just speak plainly here, whenever you see a public consensus that is deeply misaligned from a political consensus, the delta between those two is somebody's money. And if you go to Open Secrets and look at lobbying by sector, the number one biggest lobbyist by sector is pharma. Number 2 is insurance. And number 8 is hospitals and healthcare. So collectively, when you think about the behemoth that is healthcare, no industry spends more money to make sure that they can continue to make money. And unfortunately, because of the porousness of the firewall between our economy and our politics, the ability to continue that flywheel forward continues on the backs of everyday people. So there's going to be some pain in speaking honestly about healthcare. And that's going to be being willing to stand up to the influence peddling of the industry. But I think there's political gold in them, there's hills. And more importantly, anybody who's ever run for office, anybody who's ever gotten into public service, did it for some reason to solve people's problems. This is, for so many people, the number 1, 2, and 3 problem. So this is an opportunity to do the thing that public servants say they want to do, which is to solve people's problems. So let's go get it and be willing to have some boldness. And maybe while we do that, we'll find our authenticity in the process, because this is authentically a problem for people.
Yeah. I don't know about
Donald
the next
Trump's
4
never going to
years.
do this. Like Donald Trump's never going to do this. But I do think that maybe there's a forcing function among Democrats, which shows us that we've got to speak to real issues. We can't, you can't talk in euphemisms to people, right? I mean, in a room like this, where a bunch of folks have been thinking in abstractions about complex problems, euphemisms mean something. But if you're talking to folks in the community like the one I serve, they are asking you about meat and potatoes issues. What does this mean for the bottom line number that my family has to pay to get the basic things to make sure my little Charlie can get the health care that they need, to make sure that I can get the medications I need, that my mom gets the health care that she needs? What's that bottom line? And we've just got to speak to that. And we've got to be honest about why that bottom line keeps getting bigger and bigger and bigger. And we keep saying we're going to do something about it, right? But nothing really changes. And so we can decide that actually we're going to do something, and we're going to fight the industries that keep us from doing something. But it's going to be in a fight.
We always ask a couple of final questions. One of them is the benevolent dictator question. I think you've answered, which is if you were in charge of the healthcare system, what would you do to fix this problem?
I mean, I would set us on a path to Medicare for all.
Okay.
And I just also want to say one more thing, right? I started my career in public health. And in public health, our whole goal is about collective action for public good. I only really got into health care because I realized that so long as we continue to spend 20% of our whole economy on the back end of health care, we're never going to invest in public health. So to me, it really is about fixing this self-perpetuating flywheel of healthcare costs so that we can get into the business of investing in the things that keep people healthy in the first place. Because none of us want to, we all want the healthcare we need when we get sick, but none of us want to get sick in the first place. So that has to be where we go. And I just want to situate this within the broader goal of what we really ought to be thinking about when we think about health.
Yeah, I'm 61 years old, so I just hope we're still on the path to Medicare for me. Because I'm not
Goldy,
sure it will be there by the end of this administration.
God help us. The best way to keep Medicare sustainable is to put more younger people on Medicare.
I agree.
Right? That's the best single way. This is just an insurance pool. So you need younger, healthier people, right, who end up subsidizing the whole system. That's how the system is supposed to work. So it's kind of crazy to create a pool where you just take care of the costliest people. That makes no sense on its own terms, but here we are.
Okay. And the final question, Nick?
Why do you do this work?
My family comes from Egypt, and my folks there were poor. My grandfather sold vegetables at a fish market. My grandmother was illiterate. And I used to spend a lot of my summers there living the alternative of what my life should have been, but for the accident of history of my dad moving here. I have an aunt and uncle I never got to meet because they died in infancy. And, my dad was the eldest. He watched both of his siblings die before the age of 1 before he turned 5 years old. I think about our responsibility as being able to provide the best access to a long, healthy life for everybody. And that means nationally and abroad. But the crazy thing is this. I didn't have the language for it. When I'd go from just outside Detroit to Alexandria, Egypt, I'd travel 15 hours and 10 years difference in life expectancy. I could go 15 minutes into the city of Detroit and cross the same 10-year life expectancy gap. And we ought to be, as the richest, most powerful country in the world, in the business of addressing those gaps. And so, I decided to be in the business of addressing those gaps.
Well, thank you so much for being with us. It's a fantastic conversation, very timely.
Yeah, I appreciate y'all having me, and thanks for covering this.
So just to reiterate, Nick, we are not pro-violence.
Correct. We spend a lot of time and a lot of money trying to reduce gun violence in the United States of America.
Right. So, there's certainly a role for responsible gun legislation here to address things like this. And also, to be clear, we are not anti-market, right? We're not socialists. We don't want to tear down the whole market capitalist system and have state control of everything. But not all markets are the same. Not all markets function well on their own. And the healthcare market is clearly a market failure. And so there is room for an active role for government, at the very least in providing insurance, if not in running the healthcare system as a whole.
And, I think, talking to Abdul just reinforces, everything that I remember and have studied about how dysfunctional our healthcare system is and why it's sensible and righteous to be really mad about the way in which it operates and be anxious to change it. I do think that, look, the ACA is on balance a positive thing, but I do think that the Obama approach to healthcare reform set us back because we actually didn't have a conversation about how to reform the healthcare system. We had a conversation about how to include more people in a very broken system. And the whole thing left sort of a bad taste in people's mouths because we did, quote unquote, healthcare reform, and again, acknowledging that a bunch of people that didn't have access to the system now do. But for the majority of people, the system did not get materially better. Of course, there are pre-existing conditions and a couple other nits at the margin, but we still spend about twice as much per citizen per year on healthcare as the rest of the industrialized world. And it's still hard to get good healthcare, and our outcomes are still worse than most places. And so for most people, it was not a success. It was not a win. It didn't improve their lives. And so,
Yeah, I think my biggest criticism of Obamacare, because remember, you have to remember within the political context, the fight over it, how hard it was, how much Clinton failed when he tried to reform healthcare.
Absolutely.
But my biggest critique is that he refused to put any political capital into a public option.
Yeah.
I remember at the time during this fight, Howard Dean, former presidential candidate, former Vermont governor, former head of the DNC. He was in Seattle for an event, and I had an opportunity to have a conversation with him afterwards. And he basically said, look, the secret here is to get a public option, because all those arguments about a public option being a slippery slope to socialized medicine, it's true. Yeah. You get a public option through the door, and eventually it will triumph because the private industry can't compete with it. Over time, except for at the high end, wealthy people, they can afford to get their premium, whatever, but everybody else will end up in a public option, and it will be very efficient, and it will deliver. He didn't use the term Medicare for all, but it would deliver the equivalent. It would be Medicare for 90% of the people.
Yeah.
Essentially.
Yeah.
And had Obama put his foot down and said, public option, there needs to be a public option as part of this. Had we gotten the public option, I think Dean was right. I think that over the intervening years, it's the public option that would have triumphed.
No doubt.
And so it was a missed opportunity. And I think, again, look, we love a lot of what Obama did. A lot of the Obama administration, our critiques with them is that they were never bold or courageous enough. He got things done that nobody else got done, but didn't try to do more. And had he, we very well may have been on that path towards Medicare for all that Abdul is talking about. But because we didn't, we're not. And in a way, we're set back. So maybe after everything collapses during the Trump administration,
we can start over.
And we're digging ourselves out of the rubble, maybe a public option is the first thing that we'll get through whatever replaces the U.S. Congress.
Yeah. Well, that's something to look forward to anyway.
Yeah. I always like to end on a high note. If you want to hear more from Abdul, and we definitely encourage it, we'll provide links in the show notes to his podcast, America Dissected, and to his books, Healing Politics, A Doctor's Journey into the Heart of Our Political Epidemic, and Medicare for All, A Citizen's Guide.
Pitchfork Economics is produced by Civic Ventures. If you like the show, make sure to follow, rate, and review us wherever you get your podcasts. Find us on other platforms like Twitter, Facebook, Instagram, and Threads at Pitchfork Economics. Nick's on Twitter and Facebook as well, at Nick Hanauer. For more content from us, you can subscribe to our weekly newsletter, The Pitch, over on Substack. And for links to everything we just mentioned, plus transcripts and more, visit our website, pitchforkeconomics.com. As always, from our team at Civic Ventures, thanks for listening. See you next week.